Welcome to the second in a series of webinars sponsored by the Gephardt Institute for Civic and Community Engagement and the Center for Social Development in the Brown School at Washington University in St. Louis. The School of Medicine has joined us for this webinar because of the importance of the topic, Medicaid expansion. I'm Gina Gunn-McClendon, the Director of the Voter Access and Engagement Initiative at the Center for Social Development. The event is co-sponsored by the Missouri Foundation for Health. Today's topic is what's at stake in the August Missouri primary election. Let's think about that title for a minute. Just let it sink in. What's at stake in the August 4th Missouri primary? What's at stake is our democracy and the ability to cast a ballot. What's at stake is public policy that works better for all people, especially Black and other people of color. What's at stake is the ability for individuals and communities to seek meaningful ways to respond to COVID-19 and movements in defense of Black lives, voting in upcoming elections, including the August 4th Missouri primary and the November election. This webinar is a discussion akin to the words of the late, great voting rights and racial justice icon, John Robert Lewis, who said, "We all stand up for what is right, for what is fair, and what is just." August 4th is the time to vote because democracy cannot thrive without your participation, the practice of it. Today is the day to understand the importance of access and equity in healthcare for Missourians, especially for Black and brown lives. Now, before we begin, I was told to give a few housekeeping items. First, everyone has been muted and video turned off. We can unmute you at the end of the discussion about voting. Throughout the conversation, we encourage you to submit your questions using the Q&A function below. Questions can be for the panelists or other questions related to the co-host organizations. As a participant, if you see a question you would like addressed, you can upvote those questions. When we get to the Q&A portion, our moderator will take questions starting from the top. We have staff on standby to answer any other questions that aren't directed to the panelists, including questions related to voting in the August 4th election. In the spirit of civil dialogue, we do reserve the right to remove questions that are hateful or inappropriate in nature. That said, we do encourage challenging questions. If you are experiencing any technical difficulties, please feel free to send a chat to the webinar host. So let's get started. Allow me to introduce our moderator, Teresa Kuo. She is the Assistant Director for Civic Engagement Education with the Gephardt Institute for Civic and Community Engagement at Washington University. Teresa, take it away.
Thank you, Gina. We're really excited to co-host this with the Center for Social Development, a really great partner on all things voting related. Before I ask each of our speakers to introduce themselves, I'll say right off the bat that our time together is likely not enough to get to all of the questions that you may have in the audience. So as Gina mentioned, there are a few people behind the scenes. Dr. McClendon herself will be responding to questions. Lindsey Gassman, our voter engagement fellow. So any questions related to voting procedures that you might have, they'll be responding to those. And then Robert Blaine, the Assistant Vice Chancellor of Medical Public Policy, will address any questions that you might have related to Medicaid expansion. So any and all questions are welcome, and we encourage you to keep your eye on that for any responses that you might be interested in. All right, so as you are well aware, if you're on this webinar, we are just over 2 weeks away from a primary election here in Missouri, and there are a lot of questions about the process of voting, as well as what to expect on the ballot. Before we dive into some questions, I want to invite our panelists to do a quick introduction of who you are. And Eric, would you like to start? And then we'll follow with Dean Perlmutter and Dr. Hudson.
All right, thanks very much. My name is Eric Fay. I'm the Democratic Director of Elections at the St. Louis County Board of Elections. And although the St. Louis County Election Board doesn't support or oppose any candidate or issue on the ballot, I'm very happy and excited to be here today to answer questions from from the public and from other folks on this Zoom meeting about the voting process, because significant portions of the voting process have changed this year, and we are having quite a few questions about it, as people can imagine. So happy to be here and look forward to the questions.
Hi, I'm Dr. David Perlmutter. I'm Executive Vice Chancellor for Medical Affairs and Dean of the School of Medicine at Washington University.
I'm Darrell Hudson. I'm Associate Professor of Public Health at the Brown School, and I'm very happy to be here, and I'm looking forward to the questions and the discussion.
Great, thank you. So let's start with changes to voting procedure. Eric, you said you got a lot of questions from folks. So what can voters expect for voting in the August 4th election? And in particular, what should they know about the new option to vote by mail?
Sure. So just backing up a little bit from that, the folks on this call who are Missourians know that prior to this year, if you wanted to vote anywhere but at your polling place in Missouri, you had to have an excuse. You had to have a reason. You had to fill out a request and send it to us, and probably have your ballot envelope notarized. So at the end of the legislative session in Jefferson City this year, the state legislature passed a new law that added a couple changes to the absentee voting law. So there are two things about it that have changed that are most important for Missouri voters. First of all, the legislature added a new excuse for absentee voting, and that is basically vulnerability to COVID-19. So if a voter meets certain specific categories, one of certain specific categories of vulnerability, like being over the age of 65, being in a retirement home, having asthma or liver disease, kidney disease, things like that, if they meet one of those criteria, then they can vote by absentee ballot using that excuse, and they do not have to have their ballot envelope notarized. Importantly, though, the legislature added a whole new class of ballots called a mail-in ballot, which is very confusing because absentee ballots can also be mailed. But this so-called mail-in ballot is for anybody else who wants to vote through the mail. They don't have to have any reason whatsoever. They just fill out the request form, send it to us, or deliver it in person, and then we mail them a ballot. So those are two pretty important changes this year. We have seen a record number of absentee ballot requests. We have, as of this morning, we have over 82,000 absentee ballot requests in St. Louis County just for the August primary election. To put that in context, last primary election, we received about 20,000 absentee ballot requests. So we're still 2 weeks away. And although this Wednesday, the 22nd, is the deadline to request a ballot be mailed to you, voters can still come in person to vote by absentee ballot all the way up into and including the day before the election. So in St. Louis County, starting this Thursday, July 23rd, we open up 4 additional satellite absentee voting centers across the county where people can come and vote absentee, or if they've received a ballot through the mail, they can bring it there to turn it in and or have it notarized if they need it to be notarized. So there's a lot going on this year. It looks like for the August primary election, we will probably have close to 50% of the ballots cast being absentee ballots, which is remarkable considering prior to COVID, we'd never had more than 10% of the ballots cast being absentee ballots. So it's quite a change, and hopefully we can get the word out enough that folks can somewhat understand what's going on. But the thing I tell people at the end of the day, if they're interested in voting by absentee or mail ballot, go to our website or the Secretary of State's website, fill it out, send it in, and we'll try to walk them through the rest of the process. If they forget something, we're going to call them, email them, tell them what they need to do.
Great, thank you for that. Eric, I think there are a lot of health and safety concerns as it relates to voting in person, and then security and integrity concerns as it relates to voting by mail. Can you talk a little bit about what St. Louis County Board of Elections is doing to make voting as seamless and as safe as possible in both of those instances?
Yeah, thanks for that question. This is the forefront of everybody's mind this year. How do I vote safely and securely? And so as far as in-person voting is concerned, every polling place, the poll workers there have masks, face shields, gloves. They have alcohol wipes and sanitizing wipes to wipe down the stylus and pen that the voters use to wipe down the voting surfaces. In addition to that, there'll be hand sanitizer and masks available for all of the voters that come. And then we have asked the poll workers, we've provided them with strips to tape down on the floor to remind people of the 6-foot social distancing guidelines. So for the voters that do come out on election day, we want them to feel as safe as possible. As it relates to absentee voting, although the process for absentee voting in Missouri can seem a little daunting at times, like I said before, if folks just get that request in as soon as possible to us, that helps get them through the process. As far as the security goes, folks should know that when that ballot comes back to us, every single signature on the ballot is checked against the voter signature in the voter database. And then when it comes time to open the ballots and verify that everything is correct, a Democrat and Republican, a bipartisan team sit across the table from each other and open up each one of those ballots individually. So it's a very labor-intensive process, but that first result you see on election night, those are the absentee ballots. So the vast majority of absentee ballots, at least in St. Louis County and in most of Missouri, they're counted first because that's a common question we have. Do you count the absentee ballots at all? Yes, we do. We count all the ballots. That's required by law. But most of the absentee ballots are counted first. And we go through painstaking efforts to make sure every vote that we can count, we do count.
Great, thank you, Eric. There was a question from I'm starting with audience questions, but I think we have time. But just as a clarifying point related to what you were saying about absentee ballot options that extend beyond the July 22nd deadline to request, is that the same for mail-in voting? Can someone come to a satellite office to do the mail-in option if they don't have an excuse or meet one of the excuse requirements?
That's a really important distinction, that the mail-in voting, the so-called mail-in voting, can only be done through the mail. So you cannot vote a mail-in ballot in person. You cannot come after July 22nd and request a mail-in ballot. Now, that being said, there are still 7 other reasons for absentee voting, including absence from the county on election day, you're sick or disabled, you work for us, you have a religious belief or practice, you're incarcerated waiting trial, or you are susceptible to COVID. So a lot of folks qualify for one of those other reasons. As a matter of fact, so far, only about 3% of the requests for ballots for the August election have been this so-called mail ballot. All of the other requests have been for absentee ballots. So if people find themselves in a position of wanting to vote before election day, but after the deadline to request a ballot to be mailed, they can come vote in person and still qualify for one of those absentee voting reasons.
Great, thanks, Eric. I want to move over to Dean Perlmutter to talk about one of the amendments that's on the August ballot. Can you provide a brief summary of what Medicaid expansion is? This will be Amendment 2 on the ballot, and why it's important.
Can you hear me? Thanks so much, Teresa. I want to thank the Gebhardt Institute and the Center for Social Development and the Missouri Foundation for Health for making it possible for us to have the discussion today. This amendment will provide health insurance through the state's Medicaid program to 230,000 additional low-income working Missourians. The current Medicaid program provides that support for 900,000 people in the state of Missouri. So this is a big expansion of coverage. And what's unique about it is that the federal government provides 90% of that. And that compares to what currently is approximately 65% that covers the 900,000 people. The people who become eligible, the 230,000 who become eligible, have incomes that are less than 138% of the federal poverty line. And it's important to point out what this means. These are people who whose income is $18,000 a year, or that translates to $1,500 per month. These are often frontline workers in food service, personal care service, buildings and grounds workers, maintenance workers, many of the people who are essential to everything that we do, but who are not whose income is very low, surprising to many people. The Missouri Medicaid program that exists, it has one of the lowest eligibility levels for Medicaid in the country. And that's important to know. This expansion opportunity is not only important to cover more people, but we already begin with coverage that in our state is relatively low. 38 other states have taken on the Medicaid expansion, some starting in 2014 when it first became possible. And this even includes our conservative neighbors, Arkansas, Nebraska, and Oklahoma. So we really want to be number 39. And I also want to make the point that in many ways, people in the state should realize that this funding is currently going to other states and not to Missouri from the federal government. So this is, in some ways, a leveling of the field for our state and the people of our state. I'll stop there, Teresa, because I'd much prefer for us to get to questions by the end.
Sure. I do have a few other questions that I just wanted to ask you at this moment. So there are many public policy issues that show up on ballots in every election, and the university doesn't usually take a position on them. Why is Medicaid expansion different than those other issues?
Yeah, I mean, I think there are many reasons that the university has taken this position. For one thing, we want to show our leadership both in the city and the county and the state with respect to healthcare disparities that exist here. We know that we have communities within our area who have much higher perinatal mortality, much lower longevity. Medicaid expansion is a program that has already proven to improve access to healthcare, to improve health outcomes, and also because of the economics of Medicaid expansion, which brings more resources to the state, despite what you might hear from some people. This also ends up being a win for economic security for many in our community. For all of those reasons, I have gotten enormous support, unanimous support from all the heads of our departments down here in the medical school, from the chancellor and from our board and from our partner, BJC Healthcare, to lead in this issue, which has so much importance. And the last thing to mention about this is that, you know, in the era where we were all talking about racism and white supremacy, this is a policy that represents a form of inequity institutionally. So for us as a university, this is an expression of our interest in reversing inequities in our community.
Thank you, Dean Perlmutter. That's a great transition to what I want to ask Dr. Hudson. So as Dean Perlmutter mentioned, 2020 has been a year of unrests and uprisings in defense of Black lives. I'd venture to say a greater overall consciousness across our country and concern for racial equity. But it's not necessarily something that's new for us here in St. Louis. It's something that's been on a lot of our minds. And one of the recommendations for action in the Forward Through Ferguson report calls to expand Medicaid eligibility. So can you walk us through a little bit more into some details about how Medicaid expansion would affect racial health equity here in the state of Missouri.
Yeah, thanks a lot for hosting the panel. Just want to echo my thanks and gratitude to everyone who is part of the organization of this, as well as Dean Perlmutter and Eric for their efforts in pushing this through. And as it relates to racial equity, I think it's important to think about starting with a definition. So health equity means that everyone, regardless of their identity, that includes their race, ethnicity, their gender, sexual orientation, social class, et cetera, has the opportunity to reach their most optimal level of health. And we know that health doesn't just mean that you're not sick. It means your overall quality of health, your overall well-being. And so access to healthcare is an absolutely critical piece to the maintenance of health. It's hard to maintain a good level of health, much less to achieve health equity, if one simply doesn't know what their health status is. And so we've seen this play out during the pandemic. We've also seen it happen before this. When people don't know their health status, they can think that they're healthy and they're not. If you don't have regular contact with the primary care physician, or you only go to urgent care or the emergency department when you're sick or really sick or injured or something like that, there's no continuity of contact with primary care physicians. It makes it really difficult when people have an illness or chronic disease that needs maintenance and people are not taking the steps to do that. So all those things aggregate up to a broader level at the population level, and we see disproportionate rates of, say, chronic disease and other morbidities, as well as premature mortality among particularly people of color. Black Americans in the United States disproportionately are represented in not just COVID cases more recently, severe COVID cases, but also hypertension, diabetes, rates of obesity and overweight. And again, seeing how this has played out during the pandemic, when we first were dealing with COVID-19, people did not have the opportunity to get tested as frequently and when they needed to, because they didn't have access to a primary care physician. So if the recommendation was to contact one's primary care provider, if there was no primary care provider, who knows how many people could have been affected with that. So those are all some of the reasons why it's absolutely critical to expand Medicaid and in relation to racial health equity.
Great, thank you. Before I get to my last question for Dr. Hudson, I just want to remind folks to submit your questions. We'll transition to audience questions and answers after this. So make sure you submit your questions and upvote any that you would also like answered. So Dr. Hudson, in discussing your research, I've heard you talk about voting as a critical action that people can take to address health disparities. Why do you think it's important for people to vote, or why do you make sure to mention that when you're presenting your research to encourage voting?
Yeah, sure. So voting is absolutely critical. And I wouldn't ever venture to tell someone how to vote. But I think this is a critical issue, this expansion of Medicaid, for all the reasons that we've talked about before. And I think that when we think about politics, especially from a public health perspective, we often don't think about politics as a social determinant of health, but they certainly are, and they relate to many different aspects of the way we live our lives, for instance. And there's also health in all policies. It's not just healthcare policy. So if you think about the way the United States, particularly cities like St. Louis, are set up, it's not by accident, it's not naturally occurring that we see such divide and such differences and health outcomes that follow along those same lines. And so in order to disrupt the inequities that we see, we need policies and practices that can be developed and implemented to address those historical legacies of racism and other unfair practices. So this is this is one policy, expanding Medicaid, but there's many others. And in order to do that, we have to vote in order to support the candidates that we feel like will align well with the wishes of the community and the needs of the community. It's also critical for those folks to take up what people on the ground are experiencing and living their lives, their lived experience, and trying to think about what remedies can we come up with from a policy perspective in different levels of legislature to address the ills that we see.
Yeah, I really appreciate that, mentioning that it's not just about voting on policies, but how we also vote for the people who will carry forward those policies that align with our values. And so it requires us to be informed and do our research as individuals, or help our neighbors access the information so that they can make informed decisions about who and how and what they're voting for. So thank you to all of you. We'll move over to questions from the audience. We'll loop back to Eric, if that's okay. I think there's lots of questions about voting, as you may imagine. How are medical diagnoses such as asthma or others that are covered in an absentee ballot that don't require the notarization, how are they verified for absentee voting?
Short answer is they're not. The voter signs that form under penalty of perjury. So we take the voter at their word if they're going to be out of town, or if they have a medical condition or whatever else, if they have a religious belief or practice that prevents them from going to the polling place. So I always tell folks, if you feel like you qualify under one of those reasons, fill out the form and we are going to send you a ballot.
Great. There were a few more questions that were asked about voting, but I want to make sure for our audience who may not be looking at those answers. Is there a limit for how long you can be out of the county before you lose your eligibility? Or like when you say that you're out of the county on election day, like how long do you have to be out? Like, can I just like hop over to the city and then come back? And does that count as being out of the county?
So the statute does not define that specifically. It just says that it actually says you expect to be out of the jurisdiction on election day. So if you expect to be out of your jurisdiction, then you would qualify for absentee voting. And I always tell the folks who work for WashU, especially on the Danforth campus there, if you could easily expect to walk into one county or another from St. Louis City to St. Louis County, and therefore you would qualify for absentee voting, and who knows how long you would be there. So the statute is very open-ended in that regard.
Thank you for that. I don't ever want to tell somebody what those statutes mean. So appreciate that. For our student voters who are no longer like currently in the county, but maybe moving between where they used to live and where they will live in the fall, will they still be able to vote via absentee for the August election or the November presidential election should they not return for the fall semester?
Sure. Folks who, especially college students who may be in transit right now, if they're still registered to vote in St. Louis County and they intend to return to St. Louis County at some point, they can vote by absentee ballot. And the ballot, on the bottom of the form, there's an extra line for the voter to fill out if they want the ballot mailed somewhere else. So let's say they're registered at 6515 Wydown and they want the ballot mailed to, I don't know, New York or California, wherever they're living right now. That is a very common thing. If they're still living somewhere else in St. Louis County, they can change their address up into and even including on election day. Now, if you want to change your address on election day, it can be a little labor intensive, but that's completely up to the voter.
Thank you. And then there was also a request about where can people find where the satellite locations are for absentee voting.
Sure, we're going to have those up on our website. We'll have it on social media, and then probably next week, early next week, all of the voters in St. Louis County will receive a postcard informing them of what their normal polling place is going to be on election day, but also the locations of all the satellite absentee voting places.
Great, thank you. We'll switch over to David and Darrell around how has Medicaid expansion and how has Medicaid expansion and what does it mean for our communities being affected by the COVID-19 pandemic?
I can just start by saying it's made it even more important in several ways. First, the virus has shown both increased susceptibility in poorer populations, and particularly in African Americans, And secondly, it is more severe in that population. We still don't know if people who've had this infection and recover are going to have chronic problems. We know they're also more susceptible because there are underlying health issues that make them that. And then another factor that's resulted from the crisis is an increase in unemployment. And in some cases, insurance coverage comes from employment. So all of those factors have made it exquisitely more important for Missourians to have the benefits of the expansion. Darrell probably has something to add to that.
Sure, and I think I don't have much to add more than that. The only thing I would mention perhaps is the way I've heard this, and I know Gina is familiar with this, there's a term called the curb cut effect. And so it's kind of a policy solution to addressing those who are most vulnerable in a society. So people like Dean Perlmutter said, people who are marginalized because of race, also people who may be employed in low income positions, people don't have a lot of control over their day-to-day life, who live in communities that don't have as many access to resources or are, have a preponderance of fast food places and things like that don't promote health. So if we address people who are those who are most vulnerable through policies like Medicaid expansion, then we see an effect that lasts not just for that vulnerable group, for everyone, in terms of how much money we spend on, in the hospital and BJC, thinking about people who don't have any sort of healthcare coverage at all. So from a top line, from healthcare corporations and for hospital systems down to individuals who are experiencing that inequity. So that's another way to think about a rationale for why expansion could address, some of the inequities that we see. And again, as Dean Perlmutter mentioned, this pandemic has really brought to bear and really emphasized how important expansion is.
Teresa, I should add some more to that as well. One of the things that's not intuitive about Medicaid expansion is that it actually brings more dollars to the state. And I want to talk about that a little bit in relation to the question about COVID-19, because I think everybody knows it's caused a big economic impact on the state. Not on everybody, but also on the state. So we know from work that's been done, in particular at the Center for Health Economics and Policy in the Brown School. And in particular, we're talking about work by Tim McBride and Abby Barker and Karen Joint Maddox, that by taking on the Medicaid expansion alone, the state is likely to benefit in year one by an additional $39 million. And by year 5, the total will be an additional $1 billion. And part of the reason for that is because, as I mentioned earlier, the current 900,000 Missourians that get Medicaid get it with a 65% match from the federal government. The expansion population gets a 90% match. And one of the things that Tim and Abby and Karen have shown is that the state will have the ability legally to move people who are currently on their roll with a 65% match to the expansion roll, which will have a 90% match. So that's one simple way that the state will see more resources. A second way is because of the expansion, there will be more jobs related to what is being funded by the 90%, including jobs in healthcare and not in healthcare. That is estimated to be about 1,600 jobs. And that will bring hundreds of millions of dollars per year in tax revenue to the state that it didn't have prior to that. There's a third unknown source of additional revenue to the state. And it's unknown because it will take time to measure this. But improvements in health reduce cost for the state. So, and we know from the states that have adopted Medicaid that they have, by improving access, have improved health outcomes. And just a simple example, when somebody has access to a primary care doctor, they don't have to go to the emergency department, which is a much more expensive, which costs the state more money. Or people have, by not going to the doctor because they don't believe that they have the insurance to cover for it, they get sicker, and by the time they are taken care of, their cost of their care is more expensive. So there are many ways that this will improve the economics, and the economics that have been devastated by the viral pandemic. To me, this is the even bigger win of this initiative. The additional resources to the state could be used, for instance, if the state were as wise as I would hope they would be, for investments in education. And education and health go hand in hand. We know that the improvements in education lead to improvements in health, and vice versa. Improvements in health lead to improvements in educational outcomes. So, and not to mention other things that we need for the state to be able to use their resources on, all kinds of infrastructure things, development of new startup companies that lead to more jobs. So all of these things are possible through this initiative.
Thank you. I know for many of our parents of school-aged children in the St. Louis region, we're waiting for announcements about what will happen in the fall for children going to school. So I appreciate that tying of other social determinants of health that Dr. Hudson does a lot of research in. Are there other issue areas or ways in which Medicaid expansion could help the outcomes of other social issues that we should be aware of?
Yeah, I think Dean Perlmutter did a really good job providing a pretty comprehensive look at how essentially adopting this can bring in additional dollars, improve not just health outcomes, but education. I think it's, in terms of just equity perspective, again, having a relationship with a provider, because it's not just, there's 5 different A's of access. So there's not just affordability of care, it's appropriateness of care and accessibility in terms of whether you can go and seek care at hours that are appropriate for your time of day, childcare, working hours, et cetera. And so this is a step in the right direction to expand not just the affordability of care, but also some of those other access areas. And again, having people know what their status is. So knowing that you have chronic disease like diabetes, for instance, that takes a lot of self-management and can really be deleterious to your health in the long term if you don't manage it on a day-to-day basis, but it really takes quite a bit of individual effort to do that. So the more people know about their health, the better. Same thing with hypertension. Cardiovascular disease is the #1 killer in the United States. And so the more we know about our diet, whether we can obtain physical activity and other things like that to reduce our risk, the better. So those are some of the other additional things that I can think of.
What might be some of the downsides to passing Medicaid expansion? Like, why would someone be against this? Everything that you're explaining to me, I'm like, that's great. Like, we should do that. But I imagine that there are people who are against it. So can you tell me a little bit about what the resistance might be, or what the opposition might say about not expanding Medicaid?
Darrell, I'll take that one first. The main there are many what I would call irrational objections, but the main one that people will hear is that this is going to cost more money for the state. And let me run through that argument. The state actually has a balanced budget act. So it means they have to balance the budget. And what they're referring to is that the additional 230,000 people, the state will have to come up with the 10%. And so they give you they'll give you this argument that because we have to come up with the 10%, and I can actually give you the approximate numbers here, that'll represent about $900 million. It's a lot of money. And they will say that they'll have to come up with that 10%. And that, of course, then they'll have to take that away from something else because they have a balanced budget act. And frankly, that's completely bogus. They will actually be able to do a number of things that not only permit them to come up with the 900,000, but also additional monies, predominantly because they will have some categories of people who are already on the Medicaid roll who can switch from the 65%, the existing 65% federal match, to the new 90% federal match. So that's the main argument. There are also some other arguments. One argument that I've heard is, well, what happens if the federal government doesn't give us the 90% anymore? And what happens is you just go back to what you were originally funding with Medicaid. The state is not obligated to take the expansion if they're not receiving the federal dollars. So the truth is, it's hard to understand exactly what the opposition has been for this. And so people like me will say it's been completely a political position.
Yeah, I wouldn't have much to add. I think the opponent position I've heard the most is, what if we get stuck with this expansion, but we don't get federal dollars? And as Dean Perlmutter mentioned, that argument doesn't hold much water. In relation to racial equity, I think it's also important to note the regional variation in states that have expanded Medicaid and have not in the United States. And if you look just at a map, you can see that where there are states that have large proportions of Black and brown people, Black and brown Americans, a lot of those states have not expanded, particularly in the Southeast United States. So if you look at states that are traditionally red politically, those states are also behind in education and other equity areas as well. So this is a critical step in the right direction for a state like Missouri, that again, at this age in 2020 where there is a sort of a call to action, this is sort of a no-brainer call to action to sort of close the gaps and to join with states that are more progressive in their approach to addressing racial equity.
Thank you. Eric, I want to loop back to you with a question from Janice. She says, we voted absentee in the June election, and the online system for checking whether our ballots were received never showed our ballots. We called the election board and were told that our ballots had arrived in a timely fashion and would be counted. What's the current status of the online system for checking a ballot status? Is there a better way to track one's locations? And then if you could also talk about, like, when ballots get on a cure list, what's the process, and can citizens check if their ballot is on that list?
It's a good question. For the June election, in anticipation of the influx of absentee ballot requests, we tried very quickly to develop a ballot tracker, and it frankly didn't work very well, as evidenced by the question. We have worked with our vendor that mails the absentee ballots for us. It had a lot to do with the intelligent mail barcodes on the absentee ballots. So we have worked to try to get that fixed, and we think it's going to work better for the August election. As far as a cure list goes, that is perhaps an even better question, because under Missouri law, there is no cure period or no cure process for absentee ballots. And I think that's mostly a function of the very low percentages of absentee ballots traditionally in the state of Missouri. St. Louis County normally had more than most counties, with 10% of the ballots being cast by absentee. Many counties had 5% or less of their ballots cast through absentee voting. So in St. Louis County, we do make an effort to inform voters when and if their ballots have a deficiency, meaning they forgot to sign it or they didn't have it notarized when it required notarization. So if we receive the ballot back in enough time from the voter, we will just put the ballot right back in an envelope and send it right back to the voter and say, hey, you forgot to sign it or you forgot to have it notarized, please fix it. If it's too close to the election, we now will, because of the amount of ballots we're having, we're going to either call or email the voter, depending on what kind of contact information we have for them, and let them know that there is a deficiency. And if they want their ballot to count, they're going to need to come to the Board of Elections and either sign it or have it notarized. So that's about the best we can do under Missouri's framework.
And so for those who have requested a ballot and it hasn't arrived to them before Election Day, what would you recommend as the process for following up? Folks
are welcome to email or call our office and ask if we have processed their application. We can tell people that we've processed their application. We do have postal tracking on the outgoing ballot. So if we process the application, we can tell them at what point the ballot is in the mail stream. But we're pretty much up to date with absentee ballot application processing. So unless somebody has submitted a request in the last 2 or 3 days, we've processed the application. The ballot is on the way. It is taking a while in some cases. I mean, I have heard anecdotally of some slowdowns at the processing plant downtown at the USPS facility down there. But if we process it, just be patient. The ballot is going to get there.
Mm-hmm. So if on Election Day I haven't received it yet and I'm concerned, obviously I wouldn't be able to get it back through the mail to you on time, or maybe I can't drop it off. What should I go to my polling location? How do I make sure I can still vote?
Yeah, in a worst case scenario, if you never do receive your ballot, and that is a rare circumstance, people can still always go to their polling location or come to the Board of Elections and vote a full regular ballot on Election Day. They will have to sign an affidavit saying they didn't actually receive their ballot, and that they haven't already turned their regular ballot in. But once they do that, they'll be able to vote just like normal.
Thank you. So as we're coming up on time, I just wanted to do a quick go around and appreciate and thank all of you for being with us today. What is a recommendation that you would have for our audience listening today as an action that they can take, whether it's related to voting or Medicaid expansion or otherwise? What do you want them to know as they prepare for this August primary?
Well, I guess I'll go first if that's okay. Just very quickly to know your deadlines, know where your polling place is if you intend to vote on Election Day. And although this isn't about the August primary election, if you're going to vote in August, you're definitely going to vote in November. So I would really encourage people, if they want to vote in November and they're thinking about an absentee ballot, go ahead and turn in the absentee ballot application for November now. And I'm sorry, I don't want to get off of what's going on in August, which is very important. Folks should know, as I mentioned before, we're working around the clock at the Board of Elections 7 days a week to process the absentee applications and the ballots, and then to make Election Day voting work as well as it can in this crisis. and to please go vote, because as the other panelists have alluded to, it's very important. And what I always like to say is all the decisions are made by the people that show up, and we spend millions of dollars putting on elections every year that most people don't participate in. So you have a voice, you just have to use it.
It looks like you're unmuting me. Teresa, do you want me to
Sure. If
add
you're ready to
something?
go.
First, I just want to correct one thing I said. I mentioned that the 10% that the state of Missouri would have to come up with for the expanded population, I used the wrong number. It's actually 200 million, that approximately 200 million that they have to come up with. But again, that will be more than covered by the rest of what is garnered through the 90% match. I just want to say, I think there are a lot of things, a lot of changes we need to make in this state and this country in lieu of what we've seen with the crisis that's come with the virus, and also with, our concerns about how our society overall is behaving with respect to race. And I don't think there is anything that is closer to being enacted that can have an impact. It's certainly not going to be enough, but it is the first step, and it is the most proximate step that we can make to go in a positive direction and interrupt the cycle of bad things that have been happening in our country. And there's nothing that would be closer to changing that than voting for this Medicaid expansion initiative.
And I don't have much to add aside from echoing what Eric said, which is to vote. Just anecdotally living in the city, I'm always surprised and disappointed, frankly, with the low numbers of people who do go to vote, especially in primary elections like the one on August 4th. These are important elections, obviously, and have a lot of ramifications for our state and our local governments. And so I would just encourage everyone to vote, and also thinking about gearing up for the November election, which is absolutely critical as well. But don't forget about the smaller local elections too.
Yeah, thank you. I appreciate that. For us at the Gephardt Institute, we're really trying to think about how do we educate and prepare our students to become voters as an identity, as something that you participate in all the time, not just the presidential elections every 4 years. And in a case like this August primary, where you have something like Medicaid expansion that would immediately impact so many lives right here in the state of Missouri, like this is where it becomes critical that you participate and make sure that your voice is heard. And this ballot will also include several other primary elections for important seats as well. So again, I want to thank you, Eric, Dean Perlmutter, and Dr. Hudson for joining us for our panel today to talk about voting procedures and Medicaid expansion. And truly is a pleasure. I'm not a doctor of any sort, so it was really helpful for me, I know, in preparing to cast my ballot for this primary election. So before we wrap things up, I want to invite Lindsey Gassman, our Voter Engagement Fellow, to talk about some resources that we have available to WashU community members to make voting easier in this primary. Lindsey?
Yeah, thank you, Teresa, and thank you everyone for your insight and the things you shared today in today's program. As you all heard, all of our panelists mentioned the importance of voting in the August election, whether through an in-person, mail-in, or absentee ballot. And I just want to share a few of the resources that the Gephardt Institute is providing for those who are wanting to vote using an absentee or mail-in ballot. First of all, today and tomorrow from 9 a.m. to 2 p.m., I will be at the Sticks House at 6470 Forsyth Boulevard. With pre-printed forms, stamps, and envelopes so that you can mail in the absentee or mail-in ballot request. before it is due on Wednesday by 5. Feel free to call 314-935-9423 when you arrive at the Sticks House to arrange a contactless pickup. I also put all that information in the chat earlier in the session, so if you'd like to record the number from there, feel free to go there to get it. But I'll be around until 2 p.m. today, and then from 9 to 2 tomorrow, providing those resources for folks who are wanting to vote using a ballot in the mail. Additionally, once you have your ballot, unless you are voting absentee due to illness or due to increased susceptibility to COVID-19, which are excuses number 2 and number 7, you will need to get your ballot notarized, and all mail-in ballots will need to be notarized. We will be bringing notaries to the Danforth and medical campuses both this week and next week. To sign up to get your ballot notarized on the Danforth campus, you can go to tinyurl.com/woostleaugnotary. And I believe that link will be put in the chat. And then to sign up to get your ballot notarized on the medical campus, you can go to bit.ly/woosmnotary. And those 2 sites will have notaries available. You'll just need to bring your ballot, your own pen, and be wearing a mask in order to access the notary services there. And for the Danforth campus notary services, you must be a WashU student or employee in order to come to campus to access those services. For more information, you can also visit washuvotes.woostle.edu for more information about voting in this election and different addresses to send the ballot to, as well as other resources that we will be providing. Thank you all again for coming. In conclusion, I want to thank our panelists and you all for joining us today. We would also appreciate your feedback on our online survey at bit.ly/GEPH720. I believe that link will also be pasted in the chat as well as sent to you after the program. Thank you again for joining us today, and I hope you all get the chance to vote in the August election and start preparing for the November one as well.
Thank you.